Hey guys, welcome back. This is Coach Mike in the Amp Recovery Lab. We're going to come at you live. There's the whistle for another Periscope video. Today we are going over anterior knee pain. So this is Coach Kyle here. Coach Kyle, say hi.
Hi.
Coach Kyle has been plagued by anterior knee pain now for, probably a majority of his athletic career. But, when he has a heavy training day, this thing really starts barking at him. So, we just thought this would be a great opportunity to share like two really common sources of anterior knee pain and how to fix it. And that's the most important thing, is giving you guys, some tools for that toolbox on how to fix some of these issues that you might be having. Right. So the first thing that Coach Kyle's got going on is a lot of patella tendonitis. Right. So this front tendon underneath his kneecap that attaches to his shin bone, this tendon is getting really inflamed, on his squat days, just from a lot of like really heavy quad use. And, he's had some knee injuries here in the past, so he's really kind of tacked down and adheres down, through this patellofemoral ridge here. So we're gonna do a couple of manual therapy techniques to help kind of free up this kneecap, and then we're gonna move on to, I know a lot of you guys have been asking us questions about IT band stuff, and how that could be causing some anterior knee pain as well. So we're gonna go over some IT band mobs, and I'm gonna show you guys a really cool foam rolling tactic that you can use to kind of really get into that IT band a little bit better. So let's start with the patella tendonitis. We're gonna start with really kind of addressing the source of his pain right now, which is, really kind of a lot of overuse and pulling from that quad and just not having that kneecap really track through the groove all that well, right? So, he's got this little lump here in the front that's a history of Osgood-Schlatters disease, which is basically an extra osseous formation where that patella tendon attaches to. And this is really just the bony manifestation of all that stress for so many years pulling on that insertion point. And so what his body has done is kind of created this little extra osseous formation kind of as a result of that stress. So the first thing we're going to do is I've already gone ahead and heated up his whole knee and quad area with a moist heat pack. You can get on an exercise bike or an elliptical or whatever kind of metabolic heat if you want to generate it that way. But I like to use the moist heat pack. It's just a little bit more comfortable, a little easier for Coach Kyle here to kind of tolerate some of this tissue work. So the first thing we're going to do is kind of really work his quad. So I'm going to ask him to kind of scoot to the edge of the table here and just let that leg hang off. Right, so I'm going to start him in a hip extended position, okay, with his knee extended. I'm just going to kind of start warming up some of the around his quad area just to kind of get him used to the pressure. All right, you guys might have noticed this on our hamstring video. We kind of did a similar massage technique here. And, while I'm just, obviously I'm warming him up and I'm getting used to the pressure of my hands, but what I'm also doing is I'm scanning the tissue and I'm working through here and I'm kind of assessing and feeling where he's getting more tension. And I can already tell you just from a few strokes that right along this vastus lateralis and the border of his IT band is really, really dense. Okay, so when you guys are like, if you're an athletic trainer or massage therapist or physical therapist and you're doing some soft tissue work, you want to, that muscle tissue should feel kind of like chicken breast. It should be supple. It should have some give to it. This kind of feels like a piece of plastic, right? It's really hard, it's dense, and even just looking at Kyle's face when I get on that spot, he's kind of wincing a little bit. So it's definitely tender, and it's really easy to avoid this when you're foam rolling just because you want to avoid that pain, but it's really important just to kind of make sure that all these surfaces are gliding on each other. All right, so once I'm done kind of, massaging through and assessing this tissue, now I'm ready to do some more active release type therapy. So again, I'm just going to apply some more massage lotion. I'm going to bring him to a flexed position now, okay, but his hip is still extended, and I'm just going to kind of work that tissue as I flex his knee. So I'm going to actually raise you up a little bit here just so I don't have to bend as much. So if you guys have any questions or comments or anything that you're wondering about what I'm doing, why I'm doing it, again, so his patella tendon is attaching down here. I'm working on his quad so I can decompress that patella and then get some more mobilization out of this thing. So, if anterior knee pain is a problem for you, then this is a really good way to kind of start to address that from a soft tissue perspective. Right? How you doing, Kyle? All right?
All right.
All right, so right now I'm just flexing his knee for him and just getting into that border between his vastus lateralis, his IT band, and really just over his rectus femoris, which is really this big quad muscle here. Try to relax there a little bit for me. There you go. Good. I'm going to get that full knee flexion. So I like to use the term lengthen and load, right? So I'm going to load the tissue, and as I'm loading the tissue with my hand, I'm lengthening that tissue, right? So as I flex his knee, I'm putting that quad on a little bit more stretch, and I'm really just letting that tissue glide under my hand. I'm not resisting it to the point where he can't bend his knee anymore. I'm just resisting it to the point where I'm getting some extra load as I get towards that hip. Okay?
A little uncomfortable.
Oh, a little bit uncomfortable.
I think that's valid.
Right? Yeah, so again, even like, Kyle's a guy who's in here training every day. He foam rolls every day. He does his corrective exercise program. But until you really kind of get on that spot, it's kind of hard to really feel where that tension lies. But I mean, I immediately felt it and got right on that spot. So, again, just to kind of give him a little bit more out of this, what we can do is then move over to like our Graston technique or instrument-assisted soft tissue mob. Right, so I'm just going to apply a little bit of this rock rev on here. And maybe grab like a convex tool. This one will work really well. It'll fit this area really well. And even, now I want to put him in a shortened position, right? So his hip is flexed, his knee is slightly flexed, but there's definitely some give here. And I can kind of assess and get down to those deeper fascial layers now with the Graston. So I'm going to work towards his hip on both sides, medial and lateral, all through his quad, and then I'm going to really start to focus up by his quad tendon. How you feeling, Kyle, all right?
Yeah,
Is that killing you? Again, this isn't a paintbrush, guys. It doesn't tickle. It definitely, is going to be a little bit uncomfortable, but a little bit of pain is definitely worth it. I'm not really crushing him with this. Kyle gets Graston maybe done once every other week when he's really feeling the pain, so I don't want to crush him and have him never come back to me again. Or maybe I do. So now I'm just working through his VMO. And I'm working towards me now. So again, using this instrument as a scanning tool, I can kind of feel where he's getting the most adhesion, the most restriction, and I can kind of focus my treatment on there. All right, again, this is all for treatment of anterior knee pain. We're just kind of we're just moving up that kinetic chain a little bit and opening up this quad so we can decompress his patella and take some stress off of that patella tendon where it attaches on his shin. So, again, this is really just part of an overall treatment plan. We're actually going to start to move down here and start to treat the source of his pain as well. So once I'm done kind of opening up that quad, I can now start to move down and focus a little bit more on his quad tendon, his patella tendon, the medial and lateral retinacula, and then actually mobilize his kneecap a little bit. So that's exactly what I'm going to do right now. I'm going to take a smaller instrument here and just start to work around that kneecap. So basically what I'm going to do is just kind of take his patella, I'm going to frame around it. I'm just going to work outward from there so the folks at home can see. It's really, your quad tendon is pretty long, it's pretty beefy, so it goes up around that teardrop of the VMO, and you can kind of just work all the way up, through that quad tendon. This is where I maybe put him on a lot more stretch here, so that patella is well set in the groove, like we did in our kinesio taping video. This is a really good position to start to do Graston from, because I'm really putting all these structures on max length, okay? So now we can really start to break down, some of that fibrotic tissue. And you guys can kind of see, maybe you can see a little closer, the instrument that I'm using. It's got a beveled edge here on the front. It's almost kind of like a little bit of a kind of a point to it. So when I treat him with this edge, it's a very, very small surface area. So again, this doesn't tickle for sure, but for someone who's in a lot of pain, this can give them immediate relief from that patella tendonitis pain. I used to do this treatment with a spoon, so you folks at home, if this is a problem for you, I'm not saying, go get your grapefruit spoon and have at it, but, you can definitely take, the handle of that spoon and just kind of work around this patella and start to kind of clear out and create a little bit of blood flow. And that, for anything else, the value of just creating blood flow around this inflamed area, kind of restart that inflammatory process, restart that healing process, and maybe get you to move on to the second phase of healing versus just kind of getting stuck in that phase 1 chronic inflammatory condition. So we worked around this quad tendon. Now I'm going to start to come down the lateral side, okay, to that lateral retinacula, and that kind of made him jump a little bit. So I know that that's sensitive, so again, just for patient comfort, I'm going to back off a little bit there. But that tells me a lot also that he's pretty sensitive there. That could be a really big cause of some of the restriction that he's having in his knee. I'll just put a little bit more on here so I don't pull the hair out. So again, if you guys have any questions, what we're doing today, we're going over this is an actual treatment for a case of patella tendonitis that Coach Kyle is dealing with now. So right now I'm just doing some Graston technique right over his patella tendon. I'm just creating some blood flow right over that tendon to give him some relief, from that pain that he's having when he squats or he's in that knee flex position. So what I'm going to do is recreate and mimic that knee flex position, and I'm just going to mobilize this soft tissue now. All right, Dan, if you want to come around here, you can kind of get a little bit closer this front view here. Right, so now what I'm doing is actually I'm going against the grain here, right? So his patella tendon, those fibers are lining up vertically. So I'm actually going to go against the grain here. And this is almost like a cross friction massage. So think about like when you're rolling dough, right? How you can get it to all line up together. That's essentially what we're doing here. Is I'm basically creating a stress that his body can kind of reform some of that fiber orientation to. So I'm going right across that patella tendon. And for you folks at home, obviously if you don't have Graston technique instruments, you can just take your finger, right, with very little bit of lotion and just do some cross friction right over that patella tendon, until that area is actually kind of visibly red and warm. That's going to create that blood flow that you need to kind of help that tendon, recover a little bit faster. Again, so these chronic inflammatory conditions, they tend to use up all the oxygen and all the nutrients in that area, and then they get real stagnant. That's when that injury is going to linger for a long time. So basically, I'm just creating some blood flow, and I'm bringing some oxygen, I'm bringing some nutrients to the table that might have not been there otherwise. Remember, tendons and ligaments, those types of dense fibrous connective tissue, they don't have very good blood supply. So, if I can kind of mobilize and break down some of that tissue around the area and bring blood flow to the table, that's where that value is really going to come. Again, so now when we have you in this anterior view, I can kind of show you another source of Coach Kyle's pain is really coming from his IT band. Now, his IT band originates way up here in his hip and his TFL. It's a thick connective tissue band that runs down the side of his knee, and it's literally going to attach, we call this a Gerdy's tubercle, right? It's just a little lump on the side of your knee, just adjacent to that tibial tuberosity where your patella tendon is sharing. So again, in the textbook will say this IT band attaches at Gerdy's and this patella tendon attaches at the tibial tuberosity, but I can 100% tell you that those fibers, right, that connective tissue is blending together in this area, right? And we call these points of convergence, right, where lots of anatomical structures are sharing a similar attachment point and they're pulling in opposite directions, right? So the other thing I want to kind of talk about the IT band about is, everybody thinks like, oh, I got tight IT bands. I hear that all the time. Oh, my coach says I have tight IT bands. My trainer says I have tight IT bands. Tight IT bands do not exist, okay? It is dense fibrous connective tissue. For all intents and purposes, that bad boy is like bone, okay? You're never going to change the length of your IT band. I'm going to repeat that now. You will never change the length of your IT band. You can stretch the hell out of it. You can roll it with a PVC pipe. You can do all of those things, and it's going to hurt like hell, but you're not going to really get anywhere. And I'm going to tell you why. Because it's called, that's dense, regular connective tissue. So it is very, very, all those fibers are lined up in parallel in this direction. So what ends up happening is you have a lot of tensile strength. There is not going to be much play in those fibers. They are there like that for a reason. They are giving your hip stability on this lateral side. Okay, you may be able to stretch your TFL out a little bit, which is the small muscle up in your hip. But again, you're talking about a muscle that's maybe like 3 to 5 inches long, and an IT band that could be up to 18 inches long. You're not going to get too much give out of even that TFL. So the strategy really isn't to attempt to lengthen the IT band as much as it is to kind of free that IT band up from the tissue that's underneath it, right? Because our bodies are constantly proliferating or creating new connective tissue, right? Those little fibroblasts, they're called, they're little cellular organisms that are just constantly spitting out connective tissue. So in this area where you have like a lot of friction, what ends up happening is that lateral quad and that lateral hamstring, that IT band just gets stuck down to it. Okay, so now instead of having, those fascial layers slide on each other nice and easy, they're kind of adhesed down, And what's happening now is every time he goes into that deep hip flexion or that deep knee flexion, that IT band is just cranking on this insertion point, and it's just irritating the bone. So again, I like to tell people, the bone itself isn't very sensitive. It's the periosteum. And we have a skin around our bones that's very, very dense with neural fabric, right? So when I bang Kyle in the shin, it hurts like hell, right? Because that periosteum is very, very sensitive. So if it's so sensitive, just think about if I were to, attach a rope to that and just constantly tug on it, of course it's going to irritate that area. So, again, understanding what that injury or what that pain actually is will give us a better understanding of a way that we can kind of work to fix it, right? So, now that I've done some grafting around his kneecap, I've done some ART and some grafting in his quad, this is where I might do some specific patella mobilizations. And here's another really quick trick that I like to use for these types of things, is I'm just going to wipe off this lotion that I put on him. This is just a piece of old TheraBand that I cut. It ripped off. It was a little too small to use for other things. But the nice thing about this is it's very rubbery, and this has a lot of friction to it. So when I put this on his kneecap, now I can actually kind of get a better grip and really mobilize this kneecap. Right now I'm not trying to push it laterally or medially. I'm not trying to create instability in his patellofemoral joint. All I'm doing is just kind of influencing that patella to track up and down a little bit more appropriately, because it was kind of adhesed up and slammed in that groove. So this is where we're talking about more traditional fascial release. I'm just kind of putting pressure. I'm pushing that kneecap up towards his hip. I'm going to hold for 5 seconds, and then I'm going to relax off of it. So I'm just using the butt palm of my hand right on that kneecap, underneath this piece of TheraBand. I'm going to push it straight up, right? 5 seconds. I might do that 3 to 5 times. 5 seconds. One more time. And then I'm going to go ahead and switch. I'm going to work down, okay? So, again, I'm just kind of creating a little bit, when I'm going down, I like to put the knee in a little bit of flexion just to kind of free up so I'm not slamming his knee into extension. Now I'm just going to press that patella down. Okay, I'm not forcing it. I'm just taking what it'll give me and maybe taking a little bit more on each rep. Pull, pull, pull. So now that his kneecap is tracking, a little bit more efficiently, it's moving a little bit more freely, not tugging on that bony insertion so much. Now we can kind of move on to that IT band problem that we were just talking about, where, again, really this IT band, the problem here is it's kind of stuck down to the underlying tissue that's beneath it. So if we're thinking about ways to free this up, if I'm rolling right on top of it, that's really not going to free it up so well from the underlying tissue. So there's 2 strategies we can use here. One is kind of going with the grain. I'm going to shift my focus to on the IT band directly to more just kind of on top of it, or that border between his quad and his IT band. And your finger should be able to just kind of find that groove and just ride it all the way along. Maybe like anywhere between 5 to 8 kind of deep strokes. I'm pushing fairly hard. I'm using probably, I would say, moderate pressure. Just kind of trying to free up or, maybe create a little separation in that septum in between these two. And then the same thing for that hamstring board. Let me use a little bit more because I can just feel myself ripping all his hair out. I'm sure he's not happy about that. I just want to thank Coach Kyle publicly for allowing us to use his very attractive upper thigh here for the purposes of our video, but I digress. So again, we're just going to kind of go maybe, like I said, 5 to 8 strokes through that septum, separating that hamstring and then IT band out. Okay, again, this doesn't tickle, folks. This is pretty intense stuff. For you at home, just think about that lacrosse ball technique that you might be using on your IT bands or your hip. Just kind of roll that lacrosse ball right in those borders, and I'll tell you, that'll work wonders for you. It won't be nearly as sensitive as rolling out that IT band, like I said, which is very dense with neural fabric. It'll be a lot more comfortable for you and a lot more effective. So, those days of rolling that IT band that's super painful and everybody dreads it, those days are over, right? So just kind of rolling underneath and above that IT band is one really, really good tactic, kind of freeing that thing up, okay? So the second tactic I like to do is actually to create some shear force on that IT band itself. So I'm just going to kind of pad his knee. I'm going to get a bolster. so that he can keep his knee slightly flexed but relaxed here, okay? And for this, you don't want to use too much lotion because you really want to get a good grip. So I'm just going to go ahead and dry, my black leather gloves off here a little bit. And whatever I have on here already, it's kind of tacky, is pretty good for this. So the first thing I'm going to do is kind of just try to spread my fingers out. Dan, I don't know if you can kind of zoom in on this, but I'm trying to spread my fingers out and cover as much surface area as I can here. And I'm just going to kind of push that IT band kind of down and roll right over it. So similar to that cross friction, I'm literally trying to just grab into that septum and just kind of push it down. How you doing, Kyle? You doing all right? Just remember to breathe, buddy. You're good. This is only on, for millions of people to see. So we're gonna just kind of push that IT band down, okay? I'm just gonna work, again, from the knee all the way up, just trying to free up as much of that IT band as I can. And I can tell you right now, I've had fighters, professional fighters, athletes with this problem where they couldn't do a split squat without having pain or get that knee to 90. I've done this mobilization with them and completely cleared that pain in one treatment. Like as soon as they're off the table, they have no more anterior lateral knee pain. So when you can do that, that's pretty powerful stuff. If you can kind of release that quickly, and I can tell you right now, this is really locked up. So Kyle, this is probably really one of the big sources of your problem, is this IT band is just super locked up or glued down to everything that's underneath. Okay, so now that I've gone posterior, I've kind of pushed all that posterior, my favorite tactic is to kind of get my hands on top, grab my fingertips and start to pull that IT band forward. Okay, because you can really get a good grip here. I'm kind of anchoring the palms of my hands right on his quad, and I can really pull and get that IT band and really kind of give it a good yank. Okay, so again, I'm talking about moderate pressure. I'm giving that a pretty good pull, right? I'm backing off of it, maybe working my way up a little bit at a time. So I'm trying to use as many fingers as I can to spread my force out over a longer area. So it's not, if I were to do this with one finger, it would hurt like hell. So we're gonna try to use all 8 of my fingers in the front here to kind of mobilize this IT band a little bit at a time. Okay, again, this isn't for the faint of heart. This is for, that person who may be dealing with this issue for a long time and not have any relief with, just traditional foam rolling. These are deeper, manual therapies. I'm just going to work my way back down for Kyle. Just try to keep that hip nice and solid. I know it's tough. All right, working my way back down. Really when I get down to this knee here, now I can feel how freed up this is. This has actually got a good amount of mobility now. Again, so I might finish this kind of treatment up with maybe just a little bit of Graston right over that insertion point. Again, I'm not really kind of breaking anything down so much as I'm creating just a little bit of blood flow kind of right over Gertie's tubercle or right over that lateral attachment point. So again, full knee flexion and just kind of, work that tool instrument right over that insertion point. This is really light pressure, guys. I'm just kind of strumming right over that spot in a few different directions. I'm going to go against the grain, and then I'm going to go with the grain, okay? You can even hear it. I can hear it crunching away all the way down right into that lateral border or where that kind of IT band would meet the patella tendon. Okay, and that's a really quick and easy way to kind of deal with this from a pain source standpoint. Okay, so it's really easy. Just throw an ice pack on this and it feels a little bit better for 20 minutes and call it a day. This is going to give him a lasting relief from that pain. Yeah, it was a little bit of discomfort up front, but now he can go ahead and, Kyle, why don't you stand up for us? Try to get in that split squat position again and let us know how you feel. This is real time stuff here. Having any pain or discomfort there? How about switch those feet so now that you're knee dominant? How's that? Better? Yeah. So there you go, guys. That's an instant result. I just took that athlete who, a half hour ago couldn't do a split squat with body weight because it was bothering so much, and now he's doing it in here pain-free, okay? So, now we're going to go in there and, do some more corrective exercise, maybe work that hip a little bit more. Again, if you guys have any questions before we wrap today's Periscope video up, there's a quick and short, down and dirty one. But if you guys aren't following us on our social media, please do. At @amp_athlete for our Instagram and Twitter accounts, at Athletic Movement Protocol on Facebook. Definitely check out our YouTube channel too. We've been putting these Periscope videos up on YouTube. So, if you might have missed something, or you're curious about something that we already covered and didn't want to shoot that comment to us on Periscope, please go on YouTube, send us a question in the comment section or leave us a comment. We'll be happy to answer it for you. And definitely sign up for our newsletter on athleticmovementprotocol.com. Just enter your email address there. All these notes for this and the former Periscope videos will be going out down the pipeline soon. So I want to thank you guys for joining us again. We appreciate it, and we will see you guys next time. Take care.